The National Health Institute says delays are happening all over. In Arizona, people are waiting 3 weeks to hear anything. So our go-to medical expert, Dr. Payal Kohli. Hey, Doc, how are you?
Hey, Doc.
Oh, Tori's here.
Hey, ladies. Hey.
She loves you.
Hey.
I love you, too. Dr. Kohli is joining us live. Doc, so here's the thing. Very alarming that testing results take so long, because what if you're out and about, at work, sending your kids to school? Why do the results take so long?
You know, it is alarming, Sam, but it's really quite simple. It's a problem of supply and demand. As the number of cases have gone up, the demand has gone up, and the supply has just not kept up. And we're really seeing bottlenecks at every step of the way, from the collection, the swabs, the testing kits, the reagents, as well as the manpower. And I have to say, I am so disappointed as a doctor and as a scientist that so many months into the pandemic, we know that testing is so fundamental to containing this virus. We have still not been able to get our act together on this.
Yeah, testing is the one thing you kept saying from the beginning, Doc. Is there any point, though, then, in getting tested if results are going to take longer than a week to get back?
Yeah, that's a really important point. And actually, it really defeats the purpose of testing, because the idea is to catch this killer quickly. And the idea of testing is to test, trace, and isolate. So let's say it takes 2 weeks for you to get your results back, Tori. You know, the incubation period of the virus is 2 weeks. So by the time you learn you're positive, you're not even infectious anymore. Wow. And those entire 2 weeks, you have been exposing other people, unless, you know, you've been isolating at home. And those people have potentially been exposing other people. So it really is defeating the purpose, to your point.
Oh, wow, how counterproductive. This is infuriating. Is there anything that can be done, in your opinion, to speed up the process?
Well, you know, public health experts and Dr. Birx, who's part of the White House Coronavirus Task Force, have actually suggested a strategy that I think is very clever. It's called pooled testing. So we have a shortage of testing kits and manpower. So instead of testing each sample individually, why not pool 10 samples together and use one testing kit to test all 10 of them? And if they all come out negative, you're done. And then on the other hand, of course, if they come out positive, then you have to test each one individually. But we know that the majority of samples come out negative. So this strategy is actually very effective, and the FDA issued emergency use authorization for this just over the weekend. So I'm hoping that more states and more cities start to use this as a way to really help us get past these bottlenecks.
Oh, I really hope so, Doctor.
I hate when she says she's disappointed.
I know.
Like, so now I'm infuriated.
Yeah, exactly. Yeah. Oh. Geez. All right. Thank you, Doctor. We appreciate you. You will be back tomorrow. So DBL Nation, again, if you have a question about coronavirus you want answered by Dr. Kohli, please write us on social media. You can also email info@dailyblastlive.com. Again, no panic, just prevention and precautions.